Hi, I'm Dr. Mirrafati, again continuing with the series of video about breast implant and breast augmentation. So here at Mirrafati, I really have no age limit on breast implant placement. The question that most people ask, is 50 too old to have a breast augmentation? And it's absolutely not. I mean, absolutely, it has nothing to do with age. As a matter of fact, there are girls that in their 20s or 30s, they still have firm breasts. Remember, after age 40 is where the breasts start changing, right? And we talked about this in the other video, that, due to hormonal changes, lower estrogen level, and also breastfeeding for a number of kids that you might have, that actually stretches the breast and the shape changes. So you might not even need breast augmentation or want to even have it when you're in your 20s or 30s, and then maybe now you're 40s and 50s, and now you're thinking about having augmentation. The oldest lady I have done in my clinic at Mirrafati, she was actually 85, obviously, and I recommended her for that. It's amazing that at age 85, and she wanted to do her breast. And her reasoning was that I've been married for over 60 years, and God bless my husband's soul, he passed away, and now I can do sort of what I wanted to do. I wanted to do my breast all these years, and he was against it, and respectfully so. She respected his wishes, and didn't do the augmentation, which was amendable, that she actually held off on it for that many years. And she goes, he passed away, and now I want to do my breast augmentation. And I was really proud of doing that procedure for her. Obviously, we have to get medical release. She had to go to a doctor to get the EKG, chest x-ray, sort of get a medical release for a breast augmentation. But breast augmentation generally, it's not that invasive. It's in my clinic, it takes me half an hour to do augmentation. I often tell them it's like flight to Vegas. As soon as you take off, you land. So as soon as you go under, you wake up, stay in our recovery room. We do have to keep you for 45 minutes by law, but really after about 15 minutes, the patient want to go home. And I have multiple video on my on the patient testimonial about breast augmentation. You guys are more than welcome to go and see those videos. So the question that says at age 50, can I have my breast implant? Of course you can. It's more dependent upon how healthy you are. It's not mainly about, the age. It's not age dependent, and frankly has nothing to do with age at all. It basically has to do how healthy you are. If you're not diabetic, even diabetic people, as long as you're not on insulin, or even your hemoglobin A1AC is basically within a normal level, you can still do the procedure, because as I said, it's not too much of an invasive procedure, although it is considered invasive, but I'm not going to say it's non-invasive. It is an invasive procedure, but really in my hand, it takes me half an hour to do surgery. So really half an hour under, and then you're up and you go about your way. And when we do axillary, we're really not cutting any of breast tissue. Now, again, sometimes even for diabetic, when you're cutting here, there might be an issue of healing. But when you go from the armpit, there's no tension on that incision, and the healing is going to be really fast. So often we say patient can go back to work in 3 days. So at age 50, if you're thinking about doing it, God bless you. Go get it done. It will look wonderful. Take care.